Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. Welcome to today's episode of the Golden Hour. I'm your host, Dr. O, and today I am joined by Eileen Santos Rosete. Eileen holds a Master of Science in Marriage and Family Therapy from Northwestern University and is certified as a DONA, International Postpartum Doula, Trauma-Informed Yoga Teacher, and Grief Educator. She's the author of the new book, To Tend and to Hold, Honoring Our Bodies, Our Needs, and Our Grief Through Pregnancy and Infant Loss, which is initiating a powerful culture shift in how we understand this sensitive and largely misunderstood topic and how we support those who endure it. Her brand, Our Sacred Women, is known for its elevated offerings that help women feel seen, held, and honored. Eileen is especially passionate about supporting all who give birth and are postpartum, both after live births and after losses. Welcome, Eileen.
Thank you. I know before we started recording, I told you I tend to tear up. I'm already tearing up. We've just begun.
We've just begun.
That's the power of you.
Oh, no,
and
that's the power. The power of you and the space that you hold. I think you probably have a level of compassion and empathy, not only from your own personal experiences, but the many, many people that you've created space for and have held. That means that you're just so in tune and in touch with your emotions. So I feel honored that we get to create that space together.
Likewise. And before we dive in, I would love to set the tone for our time together, open our space with a short excerpt from my book.
Yeah.
This is called A Moment of Silence. Before we begin, I invite you to pause, for a moment of silence to honor yourself and your experience of womb loss, for they are deserving of such a moment. If it feels resonant, place one or both hands over your heart and either soften your gaze or close your eyes. Allow the silence to last as long as you need it to. Maybe for just a few breaths, maybe for a few minutes. And as you take this moment to be in silence, you might consider all those who are also listening and doing so alongside you. You are not alone in your pain. When you are ready, allow your breath to help return you to the present, slowly opening your eyes if they are closed. And it is with this spirit of reverence that we begin.
Thank you. I don't even want to speak. I want to create more space. But thank you. This is such a beautiful grounding way to start such an important conversation. I think for me as an OB/GYN, so many things inspired this podcast. A lot of the beauty of what I see, but honestly, a lot of the heartache and the tragedy of what I see. I think there are so many times where I sit with patients and their families, their support persons in a room where they feel heartache, they feel pain, and in those moments they feel utterly alone. And I think conversations like this are going to be normalizing, but more important, empowering, talking about steps that someone can take to heal. So let's begin, because this is an epic, really important conversation we're going to have. Eileen, do you mind sharing your own personal experience and what brought you into the space that you're currently in, and what inspired your work as a healer?
I think many moments in my life where I felt seen, I felt heard, I felt held, and I felt relief in my body. And those are moments that propelled me down certain paths that were all really quite unexpected.
Okay.
So in college, I was an Asian American Studies major at UC Irvine. I thought I would be an academic. I didn't get into any grad programs and was heartbroken.
Oh.
But all for the best reasons.
Yeah.
I ended up initiating care with a therapist, a marriage and family therapist, to explore and understand a lot of emotional angst. I think that was tied into, well, I'm not going to be an academic anymore. What do I do with my life? But a lot of core relationships were also shifting, and I was having a really difficult time emotionally and mentally. Then in our very first session together, this therapist who I would end up working with for about 5 years, she used a word to reflect back what I was feeling. And I know I mentioned this in the presentation you were on. I can't tell you what that word was. I have no clue what it was. But most importantly, it gave me pause. It was as if my body took a deep breath, and I felt so much relief in that moment with her. I walked out that door knowing that that was something I wanted to offer other people. Moments like she helped me feel of relief, of understanding. And so that set my course to become a marriage and family therapist. I also, in my 20s, I was living in Chicago at the time. I started taking yoga. And within 2 weeks of taking yoga classes pretty regularly, I felt such peace in my body that I hadn't felt. And this is with experiences of trauma on top of the mental and emotional burden I felt I was carrying. And I thought, wow, I want to help other people feel the way I feel right now, to feel that relief, to be in your body without really conscious awareness of the pain, emotionally or physically. So then I pursued training to become a yoga teacher. And then as a grief educator, I came to that work because by that point in my life, I'd experienced 2 pregnancy losses around the 12, 13 week mark. And I had come out of those experiences realizing that there was so much more we can do as a culture to support those of us who go through that, who endure that kind of pain. And so I went into a role as a grief support group leader with a nonprofit here in Los Angeles called Our House Grief Support Center as a way to help others in the way I would have wanted to feel supported. And so all these parts of my identity of really feeling rooted in that experience of feeling held and supported and that relief, that all came together in the book and wanting to help others throughout the world. I thought the book would be a perfect vehicle, perfect modality to reach so many that I couldn't possibly reach on my own. They're in private practice. And so the book is because of all these points in my life in which I felt seen, held, and honored, and wanting to help other people feel that very same felt experience.
Yeah. What I love about your story, and thank you in advance for all your honesty so far and the candor that's to come, is that it came from an unexpected, fail. I'm going to put that in quotes because I don't really believe failure. I think I truly am one of those corny people that believes that everything happens for a reason. And I'm thinking back to that moment when you're like, this is my path. I'm going to be in academics. I'm going to apply to these grad school programs. And suddenly somehow life knew you're meant for something bigger and better, that there are women and families who are now have been impacted by you in such a big way, that being an academic, being a professor is still an honorable profession and career, but you were meant for something different. And naming the people along the way, your first therapist, all those things that kind of led you to this point, I think you're honoring the importance of your own journey. And so I'm glad that we can reflect on that. Do you mind sharing more about your personal experience with pregnancy loss? And when you were going through those experiences, what did you feel like was lacking? What did you feel like you needed to support you through those experiences?
So with my very first experience of pregnancy loss, I had gone into what I thought would be my first of many prenatal appointments. And at that time, I was in the care of a wonderful OB-GYN. And she was the one to do the ultrasound. And her demeanor shifted ever so slightly from excited and chatty to a little more focused and quiet, and then sharing the news. This was many years ago, and this is what I say to my clients and to folks I talk to who work with people who endure pregnancy loss and infant loss, that even though many years may have passed, that grief may still live within us. So hence the tears now. My doctor at the time was wonderful. She didn't seem rushed at all. She stood right by my side as I registered the news and what that meant. And then I folded over in tears, and she told me that she would come back in a few minutes. She would give me some space, some time. And then she knocked on the door a little later and came in, and we talked about options to support my body in releasing the pregnancy. And she did that with such tenderness and such sensitivity. And she said she would give me time again alone to consider, and she left the room. Then later, she knocked on the door, came in, and it felt very collaborative. She understood that I wanted to try to give my body time to release the pregnancy on its own. And she, out of concern, wanted me to have the support of medication if I needed. So she wrote me a prescription for misoprostol. I had that. And we decided that I would give myself 2 weeks.
Yeah.
See if it would happen naturally. And it didn't. So come the 2-week mark, I administered the misoprostol vaginally and labored at home, in my parents' home, actually, where I grew up, and delivered in the bathroom. And that was connected to the room. And to go back to your question of what would I have wanted to have gone differently? So my OB was amazing. She was amazing. And
sounds like it.
And I include the story of her in the book. It opens one of the chapters because I want readers and providers to know what is possible and what you deserve, the kind of care you deserve. In going through that experience, I realized it would have been helpful if she had told me, rather than saying, you'll experience some bleeding and some cramping, which was very different from my actual experience, that maybe, and I put this in the book too, is frame it as, well, you'll be giving birth at home. That might sound a bit strong, but I do offer that invitation in the book to reframe miscarriage, which we often refer to pregnancy loss as earlier, as a home birth if you are releasing that pregnancy at home. Because your uterus is contracting. So it's, yes, cramping, but you can also say your uterus will be contracting. You'll be experiencing contractions. And what is held within your uterus, within your womb, will be released through your vagina. If not for having given birth already once before without medication to my oldest living child, I think it would have been a harder experience for me.
Yeah.
But because I had given birth before, vaginally, unmedicated, I was able to really recognize in the labor of that first experience of pregnancy loss that, wow, I'm having contractions.
Yeah.
And I will be giving birth. Something will be coming forth from my body. So I offer that reframe in the book as a way to help birthing women and birthing people feel more prepared than they would if they hear simply that you experience some bleeding and some cramping. That it can feel more than that.
I appreciate that reframe because I think, so much of being, to me, a good OBGYN clinician is being humbled and recognizing that we know a lot from like textbook knowledge, but it's very different experientially if you've gone through it yourself. And I think you being able to verbalize and articulate, hey, I've had an unmedicated live birth before, and that comparison physically for me felt similar to labor. My uterus was contracting. I think it empowers clinicians that I hope are listening and learning from this conversation to utilize that terminology. And for not all patients, it might not necessarily feel like contraction pain. For another patient, they might hear terminology like that and it might instill fear, right? So much of what we're doing is honoring the person and knowing that the individual and their needs is what's paramount. But I think hearing your words makes me pause and think about the time and time again I kind of describe this process and recognizing, maybe I'm not giving it what it's due by utilizing terms like cramping. I think it's always good to say, hey, it's on a spectrum. Some people feel period-like cramps, like really severe period-like cramps, but for some other women, it's going to feel like contraction pain. And so I really appreciate, I'm going to take it as a call out. I know you weren't personally trying to call any of us out, but the reason why we're having this conversation is because we can do better. And so I do appreciate that thought. Do you feel like the experience for, loss is loss regardless? Do you feel like your experience of loss was influenced in any way based on the fact that your first pregnancy experience was a live birth? Have you talked to women in the community, not only as you supported them as a therapist, but as you've gone on to create this book about women who experience the first pregnancy is a loss versus when that loss happens later in their pregnancy numbers? Any thoughts about that?
Yeah, definitely have. One good friend comes to mind whose experience of loss was very close to her expected delivery date. And then it took some time to get pregnant again with who is now her eldest living child. Yeah, it makes pregnancy hard. And the process of getting pregnant again, of trying to conceive again, very hard. There's a lot of anxiety, a lot of fear. And I have to say that that's also very similar to those who may have experienced the live birth the first time and then subsequent losses, that the pregnancies are very difficult. You're holding your breath for what might be a sign that it may end sooner than you want.
Yeah.
And so what I try to do in supporting others through the book or one-on-one is try to encourage them to, for example, maybe help your provider to help you. So one common example I share personally is that when I was pregnant with who is now my second living child, it was one pregnancy that ended in a live birth and then 2 losses, and then this pregnancy, this 4th pregnancy. Every time I went in for an ultrasound with my doctor and she would say, "How are you?" And I would say, "I'm okay, but I'm a little anxious because I've experienced pregnancy loss before."
Yeah.
So I would start every single ultrasound appointment with that, so that she would hopefully be able to deliver any sad news to me with some sensitivity. So yeah, trying to equip folks with ways they can navigate their anxiety and feel like they can access their agency, even in the smallest ways.
Yeah. No, I think about 2 archetypes of patients, right? If I think about, those are the ones who I see in the office who it's their very first pregnancy. They're coming in excited. They can't even fathom a loss. Like they don't know. I got pregnant. I got that positive pregnancy test when I wanted. I'm feeling nausea. I'm feeling breast tenderness. I am pregnant. I'm pregnant. I'm pregnant. And then similar to your OB, I'm doing an ultrasound. I'm smiling for them. And as I'm doing my ultrasound, I'm looking around and I'm like, oh, there's something missing here. I'm not seeing the thing I need to see. And my face is changing. My tone is changing. And those are patients who literally feel like the rug has been pulled out from under them because they didn't even think that this was a possibility. And then you have maybe that same patient, fast forward, body's recovered, she's emotionally recovered, she's pregnant again, seeing me. And this time she's coming in definitely with that weight on her shoulders, that heavy heart, that anxiety of like, okay, well, I'm not even happy yet. I've had patients tell me I'm not even happy yet because I'm just waiting for something bad to happen, right? That, okay, first ultrasound, hey, I see a heartbeat. This is good. Okay, yeah, it's good. Let me see if I see another one the next visit. Okay, heartbeat's still there. This is great. And really, like for those patients, understanding that it can take months into the pregnancy before they feel like they can even rejoice or be happy. And sometimes it's not even until the baby is literally in your arms can you like let go. I think it's so important for all of us, clinicians and patients, either people planning to get pregnant or already pregnant, have gone through loss in the past, to recognize that healing has no expected duration. Healing for everyone will take as long as it needs to. I mean, I think for you, part of your honesty and what makes you such a beautiful person and such a resource is that even for that loss that happened years ago, your first loss, you still make space to cry for it. That's part of your healing, and knowing that that is okay. I think that's so important. And I'm curious, from your work, again, with your one-on-ones, the work and research you probably did for this book, what is advice that you would give a woman who's experienced loss, who's trying to prepare herself emotionally and mentally, either to conceive again, or she has conceived, but she's like, okay, how can I get through this pregnancy with worrying every step of the way if this is going to be the time that I get bad news? What is your advice to prep mentally and emotionally?
My advice would be to see if you can allow yourself moments, to think in moments. Can you allow yourself moments of joy and excitement alongside all the many more moments of anxiety and fear? It doesn't have to be all or nothing. It could be a mix. And you might go through your seasons within a pregnancy or preconception of feeling excitement and then really sinking into any grief that you are carrying. I find that personally and in my work professionally, that if we can take life a moment at a time, life can feel, and the thought of conceiving and the process of being pregnant, that can feel more bearable and more doable. And to honor that you may still be carrying grief if the loss of a pregnancy or an infant had deep meaning for you, then you may feel deep pain. And like you said, there's no timeline, but can you allow yourself moments in your day, in your week, to really be with what is present for you, with your feelings? And I say that knowing very well that it is hard to feel. It's hard to really feel what you're feeling. And that is where the healing can be. That acknowledgement is so powerful. It's so simple and yet so powerful. Acknowledging that you feel what you feel. Like, what is it? I feel scared.
Yeah.
I feel anxious. Oftentimes people feel like a failure, like their body failed in some way. But can you name that? Can you acknowledge that? And I think that acknowledgement is one of the very first and powerful steps in someone's healing process. And I want to emphasize it's a process.
Yeah.
That there's no necessarily clear endpoint. And that may feel hard to hear.
Yeah. Yeah.
I was leading a grief support group recently, and I was telling the group that, grief is a response you feel to a loss that is meaningful to you. So for as long as that loss means something to you, you will feel something. You will feel grief. And that's okay. It's normal. Grief is not something you need to get rid of or get through or get past. It's just a natural response to something that's meaningful to you. Your grieving is feeling, is what I say in the book.
Yeah. Don't rush it. Don't rush that process. Just create space for it.
Acknowledge it. Yeah.
Yeah.
But to what you were saying earlier, I definitely can relate to this idea that joy can be hard won in a pregnancy after loss. With my fourth pregnancy, I didn't let my shoulders down until I was in transition. I was on the bathroom floor. I had a home birth for that pregnancy, and I was on the bathroom floor. And a friend at the time happened to text me and say, "How are you doing? I know you're laboring."
Yeah.
And that was an invitation for me to feel what I was feeling, what I'd been holding all those weeks. And I just started bawling. And the thought that came to my mind, we made it. I had to already be in transition.
Yeah.
To feel that.
Yeah.
What I know now, if I were to be pregnant again, I don't think I would feel that same relief at that point. And I know, there's so many things that can still happen after transition. And yet in that moment, I felt the relief of having made it that far.
So for you, after, if I heard your birth orders correctly, you had your first living child, your 2 pregnancy losses and births at home through those losses, and then your 4th live pregnancy was an intended home birth. But it wasn't until you actually were transitioning from early to active labor that you finally just let go. It wasn't until that moment of being full. My main good assumption as an OB that you'd only do a full term home birth, not a preterm home birth, but you were full term, which means you were months in, at least nine plus months into your pregnancy.
40 weeks and 2 days.
40 weeks. She's like, Dr. Nseo, let's count it.
I got
40
it.
weeks and 2 days that you were able to let go fully. Did you feel like, besides tears, were the other emotions joy? What else were you feeling at that moment?
The most prominent was relief. And I know I've said that word a lot in our time together, but through life's different forms of pain, physical, mental, emotional, it's that relief that has left lasting impressions on me, what has offered me relief. Yeah, my first living child I gave birth in a birthing center in just outside Chicago. It was actually a major hospital with 2 rooms for the midwives.
Yeah.
Yeah. And I realized how painful it could be to actively labor in the car and then in triage.
Yeah. Not great.
I thought I've had a really good, healthy, smooth first pregnancy.
Yeah.
But by the time I was pregnant with the 4th, I thought, I was younger, like I had all the factors that made it okay.
Yeah.
And
yeah.
we lived within like few minutes drive of UCLA, Santa Monica, and another major hospital. So, but my mom is a nurse, and I didn't tell her I was doing a home birth until
you had some good backup plans.
Until our daughter was physically out of me, then we texted.
Mom, and she went home.
She said, I knew it. I knew you were doing that.
She knew you. No, I mean, obviously the talk today is not about home birth versus hospital birth, but one of our earlier podcast episodes was with a mom who had chosen a hospital birth, and her first birth went so well, an unmedicated hospital birth, and her first birth went so well that she's like, yeah, I can do it from home the second time. So I am one of those OBs who puts no shame to home births. I think it's an informed decision. And it was one that worked out safely for you. So I'd like to take a moment to tell you this is my passion project based on years of experience as an OB/GYN doctor. I aim to empower moms and moms-to-be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so it can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Thinking about it a little bit more, do you think that your experience with your losses, your prior, to use your terms, your prior home births of those losses, did that at all influence your desire to birth in a different space? I think about trauma. I think about the physicality and emotionality of it. I think about what spaces we can create that can feel healing and whole. And sometimes home is where the heart is, quote unquote, and that sometimes home can feel safer for some people. Did that play into your decision to have a home birth, or was that a separate entity for you?
I think it certainly did. My experience with the birthing center / hospital with my first living child was wonderful. It was ideal. I want to say I had a contract being in active labor in the car and in triage.
That part.
That left a deep impression. It certainly did. And I think I very much wanted the ease of what I imagined a home birth could be. Mm-hmm. Of being at home and feeling that safety and feeling like I can focus. And, I think very much informed by my losses because I wanted to be able to focus and to feel at ease and to feel safe so I could, really be in the labor, in the moment with my child.
Yeah.
And
lovely.
I feel emotions coming up for me as I say that too. Yeah. I think very much I wanted to have a really strong sense of agency. Mm-hmm. And I had been seeing an MFM for my ultrasounds. I had 2 amazing midwives who were present for the birth. I felt very supported. Mm-hmm. And I felt like I was really able to choose my team. Yeah. And my third living child, he was supposed to be a home birth as well, but that birthing practice closed within the week I was supposed to deliver. No. I was supposed to birth. It was pretty intense. So he was, I birthed him at a local hospital here in Southern California. Yeah.
How many total living children do you have?
I have 3.
3. And then how many in total losses that you've had, or 2?
2 known.
2 known.
Yeah. 2 known because,
Yeah, there are things that
because we may not know if we.
Yes.
Every time I have my period after experiencing loss, I wonder. If that was a pregnancy. Yeah, especially if the clots are a little thicker.
It seems different.
It does seem different. That's something I couldn't get to because of word count of space in the book. But menstruating after loss is a thing. It's a whole thing. Mm-hmm. Seeing the blood. And even if you're not actively trying to conceive, it can be really activating. And I use the word activating in lieu of triggering.
Yeah, explain.
I feel given our culture with gun violence, that's really inspired me to find terms that are less violent. Yeah. And so triggering for me, even though it's so widely used in therapy. Yeah. Even yoga, like trauma-informed modalities like trauma-informed yoga. I have veered away from that in the last few years and used the word activating. So I feel like
that.
it helps you understand the same concept without being so explicitly, resonant with forms of violence. Yeah, seeing my menstruating each month and seeing my blood in the toilet. Because when I labored with my pregnancy losses, it was over the toilet for some time at least. And seeing the blood in the toilet can be really activating, even now.
Yeah. Even years out, and even I'm sure you're a beautiful person, which means I'm sure that your 3 kiddos are beautiful as well. They're a reflection of the joy and hard work and some amazing times. But I think it's so important to continue to hold space for the moments of loss and trauma and tragedy. I think something that you actually shared in the talk you gave to our group. So for context, we were very honored. My first interaction with Eileen was now probably 2 months ago when you gave a talk for our OBGYN department. And something that you had said in that talk, you mentioned you had little, I don't want to use the term idols, but you had objects to represent your losses. Can you tell me more about that? Yeah, do you want to grab them?
Okay, so these are called Jizo. In Buddhist tradition, it is an entity who is honored and looked to as a caretaker of children and women, especially as children, even those who are not born alive into this world. And in that particular faith, there's this idea that if you're not born alive into the world, you cannot then cross into the afterlife. And so Jizo is considered a caretaker who will hide the baby's spirits in but their clothing and take them into the afterlife. And even though it's religiously affiliated, it's something that more and more Americans are finding solace in. And so you can find Jizo statues on Amazon.
Yeah.
The ones I'm holding up are handmade by a wonderful woman in a northern part of the West Coast.
Yeah.
She hand makes all of these Jizo statues. She's at Great Vow Monastery and I had the pleasure and honor of visiting her as part of my book research. I spent the day at the monastery and I found this particular one. It's of Jizo holding 2 babies. And so having experienced 2 pregnancy losses, that was very meaningful to me.
Physical representation. Yeah.
Yeah. And there's healing in making what you feel internally tangible, bringing it out of you. That can be really comforting. So I have this and then as well 3 Jizo statues that are smaller for each of my living children, because one of the priests I had talked to said that living children, they can whisper their dreams to Jizo. And so, I told my children that. And the middle one, the 4th pregnancy.
Yeah.
She was pretty adamant about doing that. And she would tell me, I was whispering to Jizo.
Aw.
So for those listening, if you've experienced loss or you support those who have, offering invitations to yourself or to others to make what you feel inside tangible, to bring it, give it form. And that's what my book is, is my experiences made tangible in a way that I hope is helpful. But it's hardback, and I'm holding in front of the camera for those who are listening. It's hardback. It's very intentional because I want when my readers to pick up the book, they have this instant visceral experience of feeling
tactile.
The validity of their experience.
I appreciate that. When I think about the client who would sit down and have a one-on-one with you after experiencing their either early pregnancy loss or any pregnancy loss, let alone infant loss, what would you say are your top 3 pieces of advice you give their support people, right? We've talked a lot about the person going through the loss, acknowledging what they've gone through, creating space and agency, having tangible objects to feel the weight of what they experience, whether it's your book to tend and to hold or having figurines like the Jesus statues. What are the advice for the support people? Because those are people who've gone through their own trauma as well, but have that burden of wanting to support and love the people that they know are going through pain.
One of the first things I would say is to honor what grief you feel. So for partners, especially, for living children that they may have already, for their parents who are grieving their role as a grandparent, that you too have experienced this loss for yourself. And as much as we're centering the person who experienced the loss with their body, that your grief is no less valid.
Yeah.
And is worth acknowledging and honoring. I think that's one of the top things I would say.
Yeah. I think that's so important. I think there are times where, in those moments, I'm turned focused to the mom, the woman, the potential or past birther who went through the experience. But I always pause and have to turn to the second person in the room or the people who aren't in the room. You're right. The grandparents who were anticipating, a new addition to the family. I think to me, this conversation is a reminder for all of us who have the honor of being in such delicate moments to acknowledge everyone in the room. So having your expertise reminding us of that, I think holds weight. So I appreciate that. Other things that I think about in those moments, again, my mind floods with all these amazing people and their partners, and again, the sadness and the pain that's in that room, and my desire, my earnest wish to help them move on. I put move on in quotes because we already talked about it takes time, and there's no true way to move on besides time. What are other things that we can do to support people through their loss better? I think your first OB/GYN was a great example of all the things that she did well. Are there top pieces of advice that you would give clinicians or support people that are in the clinical sense as they are helping people go through their pregnancy losses?
Well, I would say the same thing that we just covered, that you are enduring these losses alongside your patients. It may not be your body. It may not be someone you are close to personally. And yet, on a regular basis, you are physically with them. You're holding space for them, and that can take a toll. And that's why in the talk I gave to your group, I talked about vicarious trauma and compassion fatigue. And so for those who are supporting what I call womb loss survivors, I use the word womb loss in the book to refer to perinatal loss, pregnancy and infant loss, to honor your needs and your grief and your bodies to sustain you through the work. I would also add to think of moments in your own life where you felt at your most vulnerable or most in pain, and what helped you in those moments. And allow that really deep, personal, felt experience to be ever so present when you're with someone you are trying to hold space for, because that energy will be felt.
Yeah.
And I know I said this in...
Go ahead, please.
I know I said this in our talk, but simply offering your condolences. And you spoke to this so eloquently, that there is a spectrum of, I want to say, meaning that people bring to their pregnancies. Some may experience pregnancy loss and not feel very emotionally attached to that, or may feel like they're accessing their agency in ending the pregnancy before it continues full term. Excuse me. That said, for those who you can sense and see are grieving this loss, to offer your condolences. And I invite folks to keep it simple and say, I'm so sorry for your loss. And then offering a moment of silence and space, because that can be filled with the birthing person, the birthing woman's experience. Like, she can take up space. They can take up space in that silence, in that pause. And that's really speaking to this idea of companioning, that we are walking alongside our patients, our clients. We're not necessarily the expert up here holding their hand, guiding them, but we are alongside them, experiencing it with them. So to recap, thinking of your own personal experience of feeling supported and comforted in your own time of need, and drawing on that to help you show up, offering condolences very simply, and offering a moment of silence. And that's what my OB had done in that first experience of pregnancy loss. She stood by the bedside, just stood there.
Yeah.
But her energy, it was so clear she was there for me. Mm-hmm. She wasn't in a rush. She wasn't uncomfortable. Well, maybe she was, but my experience of her was one of, she's very present for me and ready and willing to sit in that discomfort with me.
Yeah. When I hear you talk, Eileen, I hope, I'm sitting here human to human, I'm saying, I hope I was I have been and will continue to be as good as your prior OB in that space, because when I think about a clinic room, I think about a physical space where I meet patients one-on-one with their family members or support people. My ideal is I'm taking less space in that room. My ideal is if I can see that space geometrically, that I am taking up like a small fraction of the space, maybe 1-2%, and that rest of that space is for them and their family members. Like, I've done my job well when I am a small piece, a small fraction in that room, and everything else is for that person. And so if that is a visual that helps other clinicians think about what it means to really hold space, to me, hold space is less of me and more of them, and showing up the ways that that person needs me. Am I on the right track? Does that seem like I'm doing a good job?
Yes. And I would add to that you might also consider imagining maybe a color that is surrounding the room, like a cocoon, like a womb.
Yeah.
And holding space in that way. Imagine, your energy, your care as a color, and just holding them in a respectful way. And yes, to what you described, that sounds wonderful, that you are so cognizant of this being a time for them to take up space and for their feelings to be felt. And I would add also that you need to feel safe to soften. And so if your patient feels safe with you and they cry or they emote in some way, like, that's a great sign, I think, that you are doing your best, and it's really translating into a felt experience for them that is comforting.
Yeah. That's great. We've talked a lot about womb loss. And so I think womb loss is all encompassing, not only when it comes to pregnancy loss, but also infant loss. When you approach a client who's gone through infant loss, is that approach different due to the gravity of losing an infant versus losing an early pregnancy, either via miscarriage, or do you approach it the same because it's still loss, it's still pain, it's still sadness?
Yeah. I very much show up in the same way.
And
with the awareness that the pain may be deeper the longer that the person has gestated, and that they have birthed a living child. The way I show up is very much the same, despite having the awareness that the meaning can be different. For those who've experienced infant loss, that I offer my condolences. I'm so sorry for your loss. And I hold space for them with tenderness, and allow them to take up as much room as they need. More of them talking, less of me. Giving them a chance, because there's really not many chances for someone to share the story of their loss, pregnancy or infant loss, because we don't talk about it often in our culture. People are still largely unsure how to meet someone who shares that they've experienced that type of loss. And so it can feel like a rare thing to find someone who you feel safe with to name what you're feeling about your loss, even if it's been many years.
Yeah, of course. And then when I think about all the research that you probably did in preparation for this book, which we will, of course, spend time chatting about in our last moments together, this took you all over the country, potentially all over the world. Have you seen different ways that pregnancy loss, womb loss are supported in different cultures and different communities that varies from how it's traditionally done in the US? And what can we learn from that?
Yeah, it was my dream to travel internationally to do more research for the book. I traveled within the United States and Canada for most of my research. But in those years, and in talking to people, meeting them, I have heard bits and pieces that give me hope that there's really strong traditions that we may have lost touch with, but have existed, and that we can reconnect with still.
Yeah.
I remember learning about a tradition, and for those who may know of this, forgive me if I'm not relaying it accurately, but of burying the remains in a tree or near a tree, and there being really strong significance for that culture with that act. I have heard from friends who are birth workers and who are very much aware that those who experience pregnancy or infant loss are also postpartum, and they do the same things they would do for those who are pregnant after a living child, with the tenderness of that the moment calls for because of the grief. But by and large, I have come to learn that postpartum traditions that we're becoming more aware of in the States have been used for those who've experienced loss. And so here in the States, we're just on the cusp of really embracing this idea that those who are postpartum need support. You're seeing more and more birthing postpartum centers, like those that exist in Asia, pop up, where you can check in and you have everyone that you need ready to support you. But they're for living children. Pregnancies that end with living children. But yes, so warming foods, emotional support, body work that's done for postpartum people, those can often be used in other cultures for those who are postpartum after loss. But, you know, in talking to you right now, I'm like, I really need to revisit that, because I would love to. I honestly imagine my book as a coffee table book with many photographs to show people what healing after loss can look like. And in talking to you, I'm thinking, well, maybe that's something I can revisit, because it would be so lovely and so powerful to get the visuals and get deeper stories about what these traditions have looked like through history and are being practiced now.
I would love that. I'm a big support of book number 2 or part 2, if you will. There are a lot of themes that have come up through this, not only this podcast episode, but the podcast episodes that I've had and will continue to have. And that is this multicultural approach that pregnancy postpartum is supported in different ways in different cultures. That something that feels like it comes up time and time again is that postpartum sadly is undervalued in the US relative to other cultures. I've had guests share about the postpartum care centers in Asian countries, and there are more of them popping up here in the US. There's the postpartum approach to nutrition. There's the concept of the village. All these things are signs that, as you said, to use your terminology, the US, we're on the cusp. We're right there, and we have ways to grow. And it's people like you, it's change makers like you who are going to bring us there. As we wrap things up, I want to create space for one of your many creations, not only the children that you've brought into this world, the ones that we haven't had the honor of meeting, but this book, I would say, to not utilize the term, is your baby, right? You put so much.
It is my book baby.
Your book baby. You put a lot of sweat, blood, tears into this book. In your research that you've done, US, Canada, were there any particular stories or any particular person that stood out to you, that moved you in a big way? Anything that felt so impactful along this journey? Your own personal experience obviously probably nurtured this idea to create the book, but anything along the way in your research that you felt like, wow, this changes everything. This was eye-opening for me.
There are many. One particular friend who I actually referred to earlier in the interview, who experienced at-term loss, she's actually coming to mind. So she experienced several pregnancy losses after her living child, birthing her living child. She's currently pregnant, just weeks away.
Yeah.
So all the love to her.
Yes.
But in going through fertility support treatment, IUI, in particular, she had experienced a loss, and I drove to see her one evening soon after that loss. And I did what I do for my postpartum doula clients who have living children. I cooked for her. I cooked a traditional Filipino rice porridge, chocolate rice porridge. And as I was cooking for her, she sat at the kitchen table, and it was just her chance to talk.
Yeah.
And that porridge takes about 20 minutes, and you have to stand by the stove and you have to actively stir it. You can't leave it alone. But there's something about being there tending to the porridge as I listened to her that was very powerful. And I made her hot tea while she waited. And I remember turning down the lights, and I lit a candle and just creating a softer space in that way. Then we sat down and we shared the meal together. And this whole time, there's this just presence of tenderness, this energy of tenderness for this long wanted pregnancy that ended. Then after we ate, I invited her to just lay down on her couch. And I did what's called Abhyanga massage. It's part of the Ayurvedic tradition of healing medicine. And you basically take oil and you do long strokes along the body, along the limbs.
Mm-hmm.
And my friend was wrapped in a blanket, and I would gently pull an arm out, just draw her arm out and do the massage, tuck that one back in and draw the other one out. And she fell asleep. And I share that story, I think, to help those listening kind of visualize what postpartum care after loss can look like in a very tangible way, that it's simply taking time out of your busy life to be with that person.
Yeah.
To do something as simple but as meaningful as cooking for them, and warm foods that offer the warmth of a hug. And then, really giving your quality time and attention for them to share what's right that feels right for them to share with you. And some kind of gentle body work. And it doesn't have to be their whole body. It could just be their hands, just gently massaging their hands and maybe gently stroking their forehead and gently stroking their hair down. All these things that we often associate with parenting young children or babies, that kind of gentle, nourishing touch we can offer to those who are in pain and who are grieving such a somatic, such a body-based loss.
Yeah. Yeah. When I see this care that you gave your friend, I see it playing in my mind like a movie. It seems so tangible. It seems so real. I imagine her being swaddled almost like a newborn. You created a space where she felt so comfortable, so secure, so safe that she was able to rest. She was able to fall asleep. I mean, that to me is the ultimate sign of security and safety and space, is to sleep, because we only do that when our bodies and our minds are able to let go. So kudos to you to be able to create that space for someone that you love, and sharing this so that someone who's listening can either do that for someone that they care for, or more importantly, the person who's gone through that womb loss feel empowered to ask the people that love them, hey, this is how I need you to show up for me. Like, this is what I need. Can we do this? Right?
Yeah. Yeah, it's a process, figuring out what you need. And that's okay if it takes time, if it takes experiences that may not have felt so helpful, but you thought would be.
Yeah. When you think about the work that you have and continue to do within the realm of womb loss, what would you say is the biggest misconception people have about womb loss, whether it's people who, again, outsiders who maybe haven't experienced themselves, or for the people who are trying to support people through womb loss, as clinicians? What is the biggest misconception you'd say is out there?
The main thing that comes to mind is this misconception that pregnancy ends with living children, pregnancy ends with live births. And you talked about this earlier, about how you have patients show up with in their first pregnancies, excited, elated, and it's not even in their mind that there are other options, other ways that the pregnancy could end. So if we contend to this need to integrate the reality that pregnancy and infant loss is a common experience in the fertility journey, can we help folks not feel like as if the rug was swept out from under them?
Yeah.
So I think that's one of the biggest misconceptions I'm trying to address with the book, is that not all pregnancies end with living children.
Yeah. I know it's hard, because so much of what I find so humbling about my job is that you're trying to be nurturing and nourishing and hopeful, but you also want to brace your patients and their support people for things that we don't know can go awry, whether it's an early loss or things that can happen months into the pregnancy, or things that can happen at time of delivery, right? And so it's that delicate balance of, I'm here for you, I'm supporting you, let's take it one step at a time, one trimester at a time, one day at a time, without also plaguing that person with thoughts of negativity, and thinking that, oftentimes when I am sitting with that patient with that early miscarriage diagnosis, we're saying things like, well, miscarriages are surprisingly common. Most people don't know how common it is, because most people aren't necessarily going on social media posting for every pregnancy loss, but miscarriages are common, and that 1 out of 4 women will experience a pregnancy loss like a miscarriage. And I wonder, when I think about social media, and I think about people like you who are doing such a good job of utilizing it in a healthy, factual, supportive way, what role can social media have in normalizing this experience while honoring it and holding it? It's all so delicate, but what can we do in this when
I think social media is tough because if you dive into it, and I find myself hesitating to tap that icon.
Yeah.
Because it's a whole different energy. It's a whole different world that you can enter, and that can be hard, particularly with perinatal loss, because so much of the content is of the details of loss that can be really activating.
Mm-hmm.
So when I offer resources like I did with the Talk to Your group, I don't often share Instagram handles or social media resources, though they can very well be helpful. That said, I think it can be such a powerful tool for helping those who endure womb loss. I mean, I use it to promote the book.
Yeah.
I have connected with many people since launching the book through social media, helping to bring the book to other parts of the world. So there's power to it too, like you said. It's tricky. Social media. It's tricky.
It's tricky. And I'm asking a controversial question as someone who obviously uses social media to promote the podcast, and that I created the podcast because I think there's a lot out there on social media that isn't necessarily as helpful. And I want to do my part to promote something that is positive, that is informative, that is evidence-based, that is vetted. So this is my own attempt in interacting with social media in a way that I feel good about. And I think you're doing the same as you promote not only the work that you have done and continue to do, but your book. And so speaking of the book, we have moments left on the show. I'd love to give your book a shout out. Can you tell us more about it? Tell us where we can find it. All the good stuff.
My book is titled To Tend and to Hold, Honoring Our Bodies, Our Needs, and Our Grief Through Pregnancy and Infant Loss. It was released this past October by Sounds True, and it really sits at this very tender, I know you have used that word a lot today, a very tender intersection of postpartum care and also prenatal care, grief and trauma. And I've spoken to this already, but really at the heart of it is helping people to know that you are also postpartum after pregnancy and infant loss. And you also deserve all the things we deserve after giving birth. Time to rest, paid time leave away from work, nourishing food, healing touch, emotional support, all the things. You deserve them too, with an added layer of sensitivity to your grief and to your trauma if your experience of loss was traumatic. And I want to note too, with trauma, in experiencing trauma, there's an element of not having choice, not having agency. So the more that, for the clinicians listening to this and to the readers, the more that you can exercise your agency, even in the smallest ways. For clinicians, the more that you can offer even the smallest moments of choice, those can all really add up to a feeling of, I want to say, reclamation of one's agency. So with the story of my OB&I, with my first pregnancy loss, her, rather than her telling me, this is what I think we should do, her laying out options and offering me that moment of accessing my agency and exercising my choice in a situation where I had no choice at all was huge for me. And so this book, I'm hoping for it to reach many survivors as well as birth workers and clinicians. I know that your group purchased quite a few of them to have available, and our mutual friend Richie has shared this book with patients, and that just means the world to me, that they can have this and have so much information and tools that took me years to curate, to accumulate, and that hopefully they won't have to sit in like the deepest and hardest parts of their grief for as long as I had to.
Yeah. And Eileen, we've talked so much. We've talked so much about such important topics that I find to be the hardest, but the most rewarding parts of my job, right? If I helped a patient and their partner feel seen after a loss and they're still coming back to me for that next pregnancy, it means I did something right. And I feel like I'm walking away,
Absolutely.
even though I've had years of experience, I'm walking away from this conversation humbled and motivated because I have more that I've learned from you, terminology that I'm going to utilize that I think will help me support people better. And of all the topics we've covered, which I think we've covered, I think hopefully as much as we could in a finite amount of time. Anything left that we haven't touched on? Anything else that deserves space in this conversation?
Well, like you said, we can go another couple hours. I would. Maybe there's a part 2, no pressure.
Yeah.
But putting that out there. But I would love very much to close our time with a section from my book called A Closing Blessing.
Yeah, I'd love that, please.
Closing blessing for the postpartum and bereaved. May you feel seen. May you feel heard. May you feel held. And in times when you do not, may you know that you are deserving of all these things. May you be grounded. May you be slow. May you be gentle. And in times when you are not, may you return to your breath and simply be. May you know your body. May you know a softer way of being. May you know your worth. And in times when that is hard, may you choose yourself over others, even if only for a moment.
Chills. You try to make me tear up too, girl. I'm like, I've made it through this whole conversation miraculously without crying, and you got me there. No, that's so beautiful. I think anyone who has the honor of not only hearing this conversation, but more importantly, holding that book in their hands, reading those words for themselves, they are going to be better served for it. I'm so grateful that you didn't get into that grad program because you wouldn't be here right now. All jokes aside, you wouldn't be here right now. There are hundreds of thousands of people who have so much gratitude for what you have and will continue to do. So thank you for sharing a small chunk of your time with us today. And thank you for the huge impact that you're leaving on this world. We really appreciate you.
Thank you for this honor.
All right, my dear, enjoy the rest of your day. Thank you very much for listening to The Golden Hour, the podcast community where moms and moms-to-be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.